It's my feel-good breakfast show.
It is your feel-good breakfast show, Expresso on S3, and with South Africa in the grips of its fifth wave of COVID-19 and flu season also fast upon us, the expectation is that a positive COVID case numbers will continue to rise. And given the fact that we should all continue to be vigilant and practice social distancing and hand sanitizing where possible. Well, today for our health chat, we are joining us today to discuss further the fifth wave is pathologist Dr. Howard Newman and general practitioner Dr. Salim Parker, who's joining us via Zoom this morning. We also encourage you at home to join in on the discussion and send us your voice notes. You can do so on our WhatsApp line. That number is 063 408 8863. Doctor, good morning.
Good morning. Nice to be here.
Doctor, you know what? I mean, I heard this morning when I walked in, they said, the pathologist is here. And everyone is like, what is a pathologist? Let's start there. Well, what is a pathologist?
Yeah, so, whenever I'm in conversation with people, they ask me what I do, and people don't often know what pathologists do. We are medical specialists, so we are doctors who have specialized in the field of pathology. Essentially, we oversee the laboratory diagnostics. So specimens will get sent to the lab, whether it's blood or tissue specimens or whatever the case may be, and we analyze those specimens, try to make a diagnosis and give feedback to the doctor who requested the test. There's different specialties within pathology as well. I happen to be a clinical virologist.
Okay.
So yeah, we've come to the fore quite recently. But there are other specialties in pathology as well, so it's quite a specialized field. Yeah.
Okay, quite specialized. And I know that the numbers are increasing, and perhaps Dr. Salim Parker, this question can be for you. We keep hearing about the cases being on the rise again. What are we expecting with the virus moving forward in terms of numbers and severity? Is it as extreme as it was during the first wave?
Seem to be stabilizing and actually decreasing. We had a peak of about 10,000 cases a day about a week ago. The numbers are steadily coming down, but we are still in the fifth wave. As far as the numbers are concerned, what's heartening about this particular wave is that this what's termed to be a decoupling between the number of cases and the severity of the cases. In other words, where we saw in the first and second wave a higher number or higher percentage of people who were infected, getting hospitalized and actually dying from it. For example, during the second wave, about 8% of infected people were admitted to hospital, and between 0.5 and 2% of people actually died due to COVID-19. However, with this fifth wave, and even with the fourth wave, what we found was that there was a decoupling between the numbers. So even though the numbers of people who were infected and diagnosed as being positive were quite high, up to nearly 30,000 during December, for example, we found that the numbers that were hospitalized were actually decreasing as a percentage. So, and those who were dying due to COVID-19 was actually significantly less as a percentage of those who were getting infected. So that is a good news as far as the fifth wave is concerned. So the numbers are coming down, but it doesn't mean that we must throw caution to the wind currently.
Oh, yeah, don't lose sight. That's the big piece of information to take out of it. Dr. Newman, the flu season is also upon us. So now you've got another sort of viral set that you need to be concerned about. What are the ramifications as far as COVID is concerned there?
Yeah, so I am a bit concerned that we're going to have quite a severe flu season. What we've seen with the other viruses as well, the viruses that normally circulate, because of the pandemic restrictions we've had, there's been less exposure to the common viruses. That means that there's less immunity out there in the population, and you're going to have more susceptible people. So we've seen it with the other common viruses. Parents with young kids might know what RSV is. It's a virus that's currently causing havoc in ERs and hospital, pediatric wards. Right. And it's because there's just more susceptible people. So we're expecting the same with flu. I think we're going to have a severe flu season. And the message that I'd like to send out is get your flu shot.
Yeah.
There's a flu shot available. It's not too late. It doesn't necessarily prevent infection, but it will keep you out of hospital.
Okay.
So especially if you are in the high-risk groups, so people, the elderly, pregnant patients, people with immunosuppression, it's imperative that they get their flu shot. You don't want to be getting COVID and the flu at the same time. That can't.
It can't be fun.
That can't be fun.
No.
And what we do know is if you do have co-infections, where you're infected with more than one virus, you can have more severe disease. So that is a possibility as well. Also, you don't want to get COVID this week and then next week get the flu. So it keeps people out of work. So it's not great from that point of view. So the message is get vaccinated, get your COVID boosters, get your flu shots, and you should be okay.
Because I got sick not too long ago in April, and it just feels like the round of flu I got was a little bit tougher than the ones I'm used to. Usually you can shake it off in a week. This lingered for 3 weeks to the point where I went to the doctor and be like, what is going on? We did the COVID test, it came back negative. But Dr. Parker, maybe I can ask you this. When it comes to testing, what are some of the differences, between a PCR test and an antigen test?
Actually, that's the field of Dr. Newman, but from a general practitioner's point of view, what the PCR test does is to actually look at the piece of the actual virus that is present there, and it is amplified in the laboratory so that after a while, it can actually be amplified and multiplied in the laboratory setting to about 1 billion more copies of the actual number that you started off with. So it is actually very accurate. But there's a couple of drawbacks. The one is that it takes a couple of hours and at times, depending on how busy the lab is, up to a day or two. I sent 2 specimens off yesterday and I only got the results back this morning. So there is a time delay in doing that. But the advantage of it is that it is very specific and it is highly accurate. When it comes to the antigen test, the advantage of it is that you can get the result within 15 minutes. We, for example, as doctors can do it in our rooms and we can give the result to the patient within 15 minutes. What this one does is that it actually takes antibodies which your body will produce if you have COVID, but it's not specifically your antibodies. So the lab produces antibodies. Then this antibody detects part of the virus in the test that you actually do in the office or when you do it in the lab as well. So it is not as accurate, it is not as specific, and it doesn't give as good a yield as the PCR test. But the advantage of it is if it's positive, it tends to be positive. And also, it is quite a rapid turnaround. So you can tell a person within 15 minutes that you've got the result for you. What we normally do, and this is especially for medical aid purposes, is that if the antigen test is positive in the room, we then send the sample off to the lab to confirm the test result.
Okay, so there is a lot to sort of understand around that because a lot of people have been confused. But that's why we've got Dr. Howard Newman in the house, a pathologist, as well as Dr. Salim Parker, who you've just heard from now. Later on in the show, we're going to be taking some questions from you coming through on social media. So please do ask questions while they're here. Also, do make sure to send us your voice notes so that the doctors are able to help and answer where they can. 063-408-8863, that is the number.
It's my feel-good breakfast show.
Welcome back to it. Yes, it is your feel-good breakfast show. It's Expresso. We're live here on S3. It's a Tuesday. You know what we do on Tuesdays? We zone in on health and some medical chats. And one of the biggest forms and the best ways of combating COVID-19 is by taking the vaccine. We can't stress this enough. And with the case numbers on the rise, again, we're seeing so much of that happening. Now is the perfect time to get the jab or the booster shots if you have already received the initial dose. But while vaccines don't prevent you from catching COVID, they certainly do reduce the severity of the virus, and it does limit those symptoms that you might experience. And that's why we've brought into the house our pathologist, Dr. Howard Newman, and Dr. Salim Parker, who's chatting to us via a video call to discuss all that you need to know about the vaccine. We encourage you at home to join in on the conversation yet again by sending in those WhatsApp voice notes. Our number 063-408-8863.
Okay, well, I'm going to start off with you, Dr. Newman. I know that, with the COVID vaccine, the numbers are getting in the rise and people are always very unsure. But what is the importance of the vaccine? How important is the vaccine, especially given the fact that you can still get it after you've gotten the vaccine? It doesn't stop you from getting the infections.
Yeah, so we often hear from people who are hesitant to take the vaccine that why should I take it if I'm going to get infected anyway? People need to understand that these vaccines are not really designed to protect you from getting infected. The main purpose for taking it is to keep you out of hospital, to prevent severe disease. So yes, you may get infected, but by taking the vaccine, you drastically reduce your risk of ending up in hospital. And we see that on the ground on a daily basis. Yeah. The people who are ending up in hospital, they're either not vaccinated or they haven't received a booster recently. So it's critical to get the vaccine, even though you can get infected. And we know that what's driving this current resurgence, these sublineages of Omicron, BA4 and BA5, if you get exposed to that particular sublineages, you can get infected even though you were infected with COVID previously, with previous sublineages. So the vaccine is just going to reduce that risk even further. Yeah. And keep you out of hospital.
We know, I mean, on the onset of COVID, the number of wards in hospitals, I mean, they were packed. ICUs were packed all over the place. So it's good to know that that has drastically dropped. We've got a voice note from Marion, who's out in Stellenbosch. Marion, let's hear it.
Good morning. I've got a big bump on my left arm after 2 COVID jabs since last year. What is the cause of that and what do I do?
A bump.
Yeah, look, one of the common side effects of the vaccine is local trauma at the site of the injection site. So that's quite normal. But usually it subsides in a week or two and is treatable with your normal pain medication and anti-inflammatories. If she's still experiencing a local trauma there so long after, she should probably have it checked out and go to a doctor, I would say.
Like a GP would be fine.
A GP would be fine.
Okay. Well, we actually have another voice note. This one came through from Zainab. Let's take a listen.
Good morning, Dr. Parker. Please tell me, is this normal that you have this aftertaste, tastes like chemical in your mouth after COVID? And is it quite normal that you feel fluish like every second month post-COVID? I had COVID in February of this year.
Okay. All right.
Well, Dr. Parker, you are with us on the line. Have you got anything to say to Zainab?
Yeah, interestingly, we find that people who have what we call anosmia, in other words, either a lack of smell or alteration in smell, they tend to not have had severe disease. Now, we cannot put a time frame on when it's going to go away. We must take into consideration that COVID is a relatively new disease, so we are learning about it. And generally speaking, this tends to fade away after about between 3 and 9 months. There has been cases reported where this persists for more than a year, but that is exceptional. So the vast majority of people will have a return to normal as far as the taste and smell is concerned after about 9 months, but it can linger longer than that. The other part of the question was this persistence of symptoms, and this is where the entity of long COVID is being increasingly recognized. There's 3 parts to that. The one is the persistent cough or shortness of breath. The second one is persistent fatigue. There are days when you find it, there are other days that you just have energy for nothing. And the third part of it is what we call mental cognitive impairment, or the general word that everyone is using at the moment is brain fog. And again, these 3 components of long COVID are increasingly being recognized. Not enough is known about it. We do know that it can last for more than a year. There seems to be newer evidence coming out that the medication, the oral medication that is not available currently in South Africa, seems to improve these conditions. But currently there's no treatment available in South Africa for it. See, that's the negative part. The positive part is that most people tend to get better as the longer the duration of after they've had the exposure. So this is another reason for people to get vaccinated. Yes, a lot of people feel that they're going to get mild disease, but we cannot guarantee that long COVID will not be an effect of even mild disease. So bottom line is get vaccinated, try to prevent getting infected in the first place.
Thank you, Dr. Salim
you.
Parker. Please don't go anywhere. We have got Dr. Parker as well as Dr. Newman with us as we continue our health conversation. If you want to be part of it, you can send us a voice note. That number is 063 408 8863. If you have a comment or a question, please send it through.
It's my feel-good breakfast show.
Now, we have been speaking all things COVID-19 this morning with our two experts, Dr. Howard Newman in studio and Dr. Salim Parker via Zoom, who have been giving us updates and insights into the latest with regards to the pandemic. Now, we've also been asking you to send through any questions you might have, either via social media or on our WhatsApp line, which is 063 408 8863. And we're going to jump straight into some of those voice notes right now.
We got the first one from Chris, I believe. Chris?
Okay, so Pfizer has released another batch of side effects, which is a whole lot. I'd like to know what the doctor has to say about that. And I mean, if I say it's a lot, it is a lot.
Side effects. So I believe what Chris is saying is that there's a whole host and a long list of side effects that people experience from getting vaccinated. Maybe let's touch on some of the common ones and maybe some of the ones that maybe are newer, if that's even such a thing. Thanks, Chris.
Yeah, no, there are common side effects. So, like the previous WhatsApp note, pain at the injection site is the most common. Depending on which vaccine you get, you can have flu-like symptoms after getting the vaccine. That's very common. I know I had that and I felt quite sick. But I think those are the two main ones. You can have muscle aches as well. And then you have your more rare side effects, which can be cause some severe problems, but those are very rare and shouldn't deter people from getting vaccinated.
And then I know a lot of people who have been vaccinated, they now due for the booster. Can they mix the difference? Because I know in South Africa, a lot of people got the J&J or the Pfizer. Yeah. So if you got your 2 shots of Pfizer, are you advised to get the J&J booster or do you stick to Pfizer?
Yeah, so mixing and matching is allowed. Which one to choose is basically based on availability, I would say. If both are available, the current guidance is to stick to the same vaccine as your primary series. That's called homologous boosting. Yeah. So if you've had 2 Pfizer shots as your primary series, if Pfizer is available, I would get a 3rd Pfizer booster. And you're eligible for that 90 days after the second dose. Okay. For J&J, it's 60 days after the last dose.
Okay, let's go to the Eastern Cape. We have a voice note from the Eastern Cape. Who sent it to us? It's Janine. Janine out in the Eastern Cape. Let's hear it.
Good morning. I have a question. Last year, I had Omicron and 2020, I had COVID. So does this also help me to build immunity against the virus so that I do not need to take the vaccination?
Thank you, Janine. So I imagine, of course, Omicron is a variant of COVID-19, still part of that set, right? Yeah. But to answer her question, maybe Dr. Salim, you can answer that one?
Okay, yes. Firstly, the immunity induced by natural infection is slightly different to the immunity induced by the vaccine. And it has been shown by quite a few studies that if you had infection and you had the vaccine, that your resistance to subsequent variants, such as the current B5, is better than either having had the vaccine alone before or you've had the infection alone before. So even though you've had COVID in 2020 and the Omicron at the end of last year, our advice would still be that you should take the vaccine because it will boost the immunity that your body naturally has produced by targeting certain parts of the virus where the vaccine itself will help actually increase the immunity. So the best is, even though you've had the 2 bouts of infections, to still take a series of vaccine boosters.
Okay. All right, Dr. Salim Parker, thank you very much, General Practitioner, for joining us this morning. And of course,
Pleasure.
Dr. Howard Newman is a pathologist in clinical virology who've really been so helpful this morning, helping us unpack COVID-19. Because just when you think you've got it and you understand COVID-19, every day we learn something new. Thank you to everyone who sent in their voice notes and for asking those questions. Really helpful. Of course, the resources are available, plenty of them. Please do continue to educate yourself around COVID. Wash your hands, sanitize, social distance, wear your mask everywhere, and vaccinate.
Vaccinate.